Hello, Dr. Volodymyr is here, and today we are going to talk about the hair and about the hair loss problems. Actually, the hair is one of the characteristic features of mammals and has various functions. Let's list some of them. Secretory function, thermoregulation, protection against external factors, and it has certain impact on our social and sexual interactions. Although the hair loss problems are not life-threatening, however, they do influence on the patient's psycho-emotional well-being. It implicates massive growth in a trait segment concerning hair loss disorders and hair structure improvement. Hair is a skin appendage and derivative of the epidermis and consists of two distinct parts: hair follicle, which is a complex mini organ, and the hair shaft. Hair follicle is an essential part for the generation of hair structure. The hair follicle has a continuous growth and rest sequence named the hair cycle. It's a lifelong cyclic transformation from a resting phase to a growth phase, continued by a regression phase, leading to the involution of the hair follicle. The duration of rest and growth phases coordinates by many vascular, endocrine, and neural stimuli, which cross-react during the hair cycle, and depends not only on the localization of the hair, but on various factors such as age, nutritional habits, and the hormonal profile. Intensive knowledge of anatomical and physiological aspects of hair can contribute to understand and to treat hair loss disorders, but we have to admit that the hair losing is just a symptom, but not the real existing disease. Proper examination and evaluation of the hormonal profile and the blood report, assessment of scalp parameters is an essential part for every patient with hair loss disorders for establishing a correct plan of the treatment. Causes of alopecia in the female and male population are different, and that is why the list of analyses is different as well. Today we are going to discuss the list that appears to be the most important for ladies. Female hormonal profile: estradiol, progesterone, prolactin, and all the fractions of testosterone. You should strongly consider testing if you are a woman struggling with the appearance of too much hair on your body, irregular menstrual cycle, or probably if you're experiencing acne. Transferrin saturation and serum ferritin remain the favorite markers for assessment of iron status, and when measured will help you to find out the presence of hidden anemia, especially if you like to play with diets, if you're a vegetarian, or the person with abnormally heavy menstruations. The next is thyroid hormonal panel. The evaluation of T3 and T4 levels is essential to understand the functional ability of this gland, especially if you are the person who continue to lose the weight, or in opposite way, if you observe too much of fat accumulation. Another one reason to be concerned if you do have such symptoms like hand tremor and mood lability. Microelements level is also critical to know, and 4 of them have the highest clinical value: selenium, calcium, zinc, and iron. And of course we shouldn't forget about the complete blood count and the glucose blood level. But of course all these analyses have to be evaluated by the qualified physician, and only afterwards the doctor will be able to do a subsequent prescription for you. You shouldn't be scared if the doctor will prescribe you some medicine immediately after initial examination, because in some situations the hair could be in a deplorable state. And sometimes it might take a few weeks to wait before the patient can do the hormonal profile test, simply because the hormonal profile test has to be performed on a certain day of the menstrual cycle. There are many agents that may trigger on hair growth cycle and therefore hair structure. Apart from well-known drugs like minoxidil and finasteride, there are also many potent agents and methods that may help to modulate a hair growth cycle, which may have good outcomes for hair loss treatment. Nowadays, patients can be and should be fully informed about the suitable treatment adapted to them. Therefore, they will be able to follow more effectively all those positive effects given by their own individual therapy. In next video, we'll discuss more on efficient treatment modalities of hair loss problems and hair structure improvement. Thank you so much. Stay healthy.